Speaker, I note that Albury Hospital, Albury campus is recognised, classified as a regional trauma service under the Victorian Health. And for those in the House who may not be aware of what that implies, health.vic.gov.au spells out that RCSs are located in major regional centres and receive appropriate referrals from surrounding catchment areas. They provide resuscitation and stabilisation of major trauma patients prior to the transfer to a metropolitan trauma service. They also provide definitive care for a limited number of major trauma patients where their injuries are assessed in agreement with an MTS as not requiring a transfer. So we have in Albury a major regional centre, an emergency department that across Albury and Wodonga see over 70,000 presentations to the emergency department each year. As said, classified it as a regional trauma service. And then when we look into what the Australian and Aotearoa New Zealand Trauma Verification Program, the model resource criteria for trauma services set down by the Royal Australasian College of Surgeons, a rural trauma service should have a helipad or a documented agreement for fixed wing transport to major trauma service. So in the situation of Albury, Speaker, we have a regional trauma service as classified by one of the jurisdictions responsible for Albury Wodonga Health. We have a significant emergency department with 45,000 presentations at Albury alone, 70,000 across the Albury and Wodonga campuses of Albury Wodonga Health. We have the relevant College of Surgeons specifying in their model resource criteria that such a location should have a helipad in that regard. And then following with that, we have a situation where under the significant funding, and I acknowledge and I recognise the Parliamentary Secretary in the House here, I acknowledge the Minister and his support for the redevelopment of the Albury campus. I recognise the investment that's been made there, but it is something that is, I'll be quite clear, that the $558 million, as the Parliamentary Secretary for Health knows, that investment, when announced, had a helipad. And I'll be clear to the House, that was part of my fight to get funding for Albury campus. One of the important aspects that I raised with Minister Hazzard at the time, and we achieved, was funding for a helipad. And it is value management now, not any other reason. And the Parliamentary Secretary stood here and say that it's about needs. There was a need because it was funded. It was identified by both the Victorian and New South Wales government that it needed a helipad, but it is pure and simple just value management that it's been taken out. And this is what this bill sets out to do. It says you just can't make decisions just on that financial basis. You need to have a regard for the needs of the community. And if we have in place, rather than a one-size-fits-all, and I acknowledge that comment, but as I foreshadow with the amendments will make it appropriate for the level of service. If you've got a level of service, if you've got college saying that that is something that we should see, then that is what we need. And that is all this bill sets out to do. So, Speaker, I welcome the opportunity to make this contribution. I thank the member for Kiama for bringing this bill before the House. I continue to urge government to continue to make investments in our infrastructure. I recognise the pressures right across our health services, but there is a need there. It was identified, and in terms of Albury campus, it was taken out. That is why I am supporting this bill. Yeah.